In today's lecture, we are going to talk about PCOS treatment. Now, before I talk about the treatment, let's do a short recap. So we made mention in my PCOS video that there are certain fat cells that will produce estrogens, and then we looked at the luteinizing hormone, one of its roles being conversion of testosterone to estrogens. And we said that this reaction produces about less than 1% of estrogens. So it's actually not the main reaction that produces estrogen in a young woman in a reproductive age. We looked at the main source of estrogen in a female, which we saw was the action of FSH on the ovules to produce estrogen. Alright, so let's look at how we will treat PCOS, looking at this diagram. So first of all, let me target the fat cells. Now, the fat cells, we made mention of obesity being a serious or a major risk factor for PCOS. Now, one way to reduce your fat cells is to exercise or reduce weight. So weight reduction is one. Now, I made mention of insulin resistance or insensitivity in my PCOS video. Now, what happens is that now there's a short calculation to actually help us know if one is obese or not, even though that formula is not too accurate, but we'll still use it. So that's the BMI, the body mass index. So we saw that for people who have BMI greater than 30 kilogram per meter squared, these people are usually said to be obese. So what happens is that they have a lot of fat cells under their skin, and so these fat cells are able to bind to some tissues. So we have this muscle to fat ratio. Now, every muscle, especially the skeletal muscles, have a certain percentage of fat, so which is about 35%, and it has about 15% of protein, and then it has about 50% of carbohydrates. Now, what happens if someone is obese? What will happen is that it means that this percentage will change, because you have a lot of fat in someone who is obese, and so these fat cells change the ratio of this muscle to fat ratio. And once these fat cells, the ratio is changed, it means that for a particular muscle you have a lot of fat other than the proteins and then the carbohydrates. Now, there is this, and this actually can lead to what we call insulin resistance. Now, when someone eats any meal at all, insulin is produced, and that helps the skeletal muscles to be able to absorb the glucose to help with energy generation. Now, what happens is that when you have a lot of these fats surrounding the skeletal muscles, it makes the usage or the absorption of glucose very difficult, and that's what we term as insulin resistance, meaning that even though you have a lot of insulin in your body to help with skeletal muscle absorption of glucose, it is still not, you are not able to absorb them because of the high levels of fats around the muscles. So anybody who has or is obese has a lot of fat cells, and then once this ratio is changed, it's going to affect the way your body uses glucose, and this indirectly or directly is going to affect your insulin levels. So one major way to actually treat PCOS is to manage your weight, and that's actually the primary way to treat PCOS. Once your weight has been managed, you are very sure that your condition will be managed or treated. Now, let's look at this reaction. Now, I said that this reaction actually produces about 1% or maybe less than 1% of these estrogens, meaning that there is a lot of testosterone in a female who has PCOS, And then we saw that testosterone is responsible for the virilism or hirsutism, where you have hair growth in some areas that they are not supposed to have, like the beard, chest hairs, and then even ears, hairs on the ears, which we term as hypertrichosis. So we need a drug that can actually bind to this hormone so that you don't produce these estrogens. Because we saw from PCOS pathophysiology that the estrogens here together with those here increases the levels of estrogen, and that is what inhibits the production of FSH. And because this reaction doesn't occur in PCOS, meaning that we have the estrogen produced are from this and then that, and then whilst you have a lot of these, they're able to inhibit FSH production. So if you want to restore this hormonal imbalance, then of course, I should be able to target fat cells, I should be able to target the testosterone, which is what I've talked about concerning the fat cells. That once you reduce weight, these fat cells will be reduced in numbers, and then this whole side effect of fat cells or obesity causing the PCOS will be tackled. And so we need a drug that can actually bind to this testosterone. And one of the main drugs that has been used over time is the oral contraceptives, the daily ones. So that's the oral contraceptive, the daily. So this contraceptive actually has they have both estrogen and progesterone. Now what does this estrogen in the daily oral contraceptive, what does it do? Now what it does is that this estrogen stimulates the liver to produce a certain hormone we call the steroid hormone binding globulin protein. So this hormone is actually what binds to testosterone. So we are expecting that once this hormone binds to this, then of course this whole reaction will leave the system. And in that case, we are going to reduce the levels of estrogens produced by this reaction. Okay. So someone will ask, why then do we add progesterone to this estrogen in the oral contraceptives? Now, estrogen alone could have done the work, but studies have also shown that for anyone who is taking just a contraceptive made up of only estrogen, he or she is at risk of getting other cancers like endometrial cancer. So we add progesterone to actually regulate the action of estrogen. So these two hormones are antagonistic in action. So what this actually regulates the action of this. All right. And then we'll look at how to manage the insulin resistance. So we have looked at reducing body weight being one way to reduce or manage PCOS. Then secondly, we've looked at this drug, the daily oral contraceptives, being able to help us treat PCOS to some extent by producing estrogen in this the daily oral contraceptive, producing this hormone, and then this hormone binds to testosterone and then helps to limit or reduce this reaction. Alright, so let's see how to manage insulin resistance. So as I said earlier during the fat cell dialogue or treat lecture, that once you have a lot of these fat cells binding to your muscles or the skeletal muscles, it reduces your intake of glucose. And this is what we term as insulin resistance. Now there are certain drugs that can help you to treat or manage this insulin resistance. And one of the drugs that has been used over the time is metformin. Now metformin is an anti-diabetic drug that helps to regulate sugar levels. And then one good thing about metformin is that it's able to reduce insulin resistance by increasing cell sensitivity to insulin. So by so doing, while someone is on metformin, is on the daily oral contraceptive, and is also exercising, then we are seeing that the person has targeted the major causes of PCOS, and this will help you manage your PCOS. Thank you for watching. Stay tuned.